So when we test a squat jump, we make sure that there is no counter movement. Otherwise, we want to eliminate that from our testing. But conversely, we're not really in the habit when we do a counter movement jump of testing to make sure that there is sufficient loading through that counter movement to be able to appropriately assess an athlete's stretch shortening cycle capability. Eccentric peak velocity then may be the metric that enables us to do this. This tells us the maximum velocity that an individual reaches during that eccentric phase and has otherwise been described as peak negative velocity or perhaps peak braking velocity. Eccentric peak velocity is a metric that the creator of Horsedex, Dr. Dan Cohen, has been shouting about, and he's definitely someone I pay attention to. And there's also a series on the VALD blogs written by himself and Dr. Morgan Williams, all about eccentric peak velocity. So in this video, I'm going to explain what this metric represents and how we can use it with both healthy and injured athletes. So let's take a look at this figure then from that VALD blog. Here in the black, you have the usual force time curve from the counter movement jump. Hopefully now you're all familiar with that, but if not, definitely take a look at my other videos in this series on athlete testing in collaboration with VALD, where I've got a number of videos then talking about the counter movement jump. Here then in this figure, we also have the counter movement displacement shown in red, which aligns then with our little illustrations here of the different phase of the actual takeoff. Crucially as well, in blue then we have this eccentric peak velocity trace. Specifically, the eccentric peak velocity marks the beginning of the eccentric deceleration phase. This is when the individual's force has gone above their own body mass then, and they are actively having to brake and decelerate themselves from the downward squat in order to then ultimately change direction into that concentric phase of the upward portion of the jump. The eccentric phase then represents the entire downward phase within the counter movement jump, but we have a number of sub-phases within it. We have our unloading phase, where the force actually reduces as we start the descent into our counter movement. We then have our yielding phase as force begins to increase again, and then our deceleration phase as force goes above the equivalent of body weights in newtons. Together, the yielding phase and the deceleration phase are collectively referred to as the eccentric braking phase, when the athlete is actively creating these braking forces. So we can use EPV then as kind of a gatekeeper metric. We want to do a check of this value first before we start assessing the outcomes of all the other eccentric metrics within that phase of the jump. Now, a critical thing here is that we are dealing in the negative, in the eccentric braking phase, and therefore the higher the negative value for EPV, the faster the eccentric phase will be. For example, minus 1.4 meters per second is faster than, say, minus 1.0. It can get a bit confusing, obviously, because we're thinking about higher or lower, but actually it's flipped because we're in the negative. Let's look at some applied examples then. Firstly, considering our healthy athletes. And Dr. Dan Cohen, based on both his own analysis and analysis of the massive VALD data lake, they've expressed that minus 1.2 meters per second is an appropriate cutoff for healthy male athletes to identify that a jump was sufficiently loaded through that counter movement. Here then we can see data pulled from VALD's data lakehouse with the mean and the 25th to 75th percentile bands illustrated for eccentric peak velocity. This minus 1.2 meters per second threshold, that may well be a suitable point for our male athletes. Generally, our female athletes tend to reach lower eccentric peak velocity, so we might want to shift that threshold. And indeed, in data that I've seen from professional football, a men's team the average can be around this minus 1.4 value, but the average on the women's side tends to be more around minus 1.2 itself. So I wouldn't really want to use that as my cutoff. Perhaps a more sensible cutoff in women's team sports is around minus 1.0 meters per second. An adequate eccentric peak velocity then is a prerequisite to actually challenging the eccentric capacity and therefore actually assessing an individual's counter movement and their stretch shortening cycle abilities. Why then might it be lower than whatever our threshold is? Well, firstly, we want to check the actual execution of the movement. Is it something the individual is familiar with? Or did they just try and use more of a squat jump approach? That links them with our coaching cues. Did we have an appropriate protocol and cue them sufficiently so the athlete understood the task? It may be appropriate to use to flag jumps that just frankly don't have enough intent in them. So has the athlete truly given their maximal capacity in that test? If not, we probably want to remove it if indeed that is the purpose of our tests. An insufficient EPV may also link to pain or discomfort. So in our healthy athletes, this is perhaps useful from that monitoring perspective. It might be highlighting that this athlete still has sufficient soreness from perhaps a game a day or two previously that they aren't able actually and comfortable to squat down enough into a counter movement jump. There is a bit of a different context then with our injured athletes. Whereas in a healthy athlete, that shallow counter movement jump depth might be a sign of either lacking intent or perhaps fatigue and soreness from a game day. In our injured athletes, it can be perhaps a sign of lacking confidence or perhaps even the ability to do that in that stage of their rehab. Rather than using it perhaps as more of this cutoff point, we actually want to track the EPV through their rehab and see the progression in that speed in which they're able to break themselves during the counter movement jump. Here then, thanks to VALD, we have data from Dutalis and colleagues illustrating the mean EPV trajectory for counter movement jump data from 20 to 60 weeks post ACL reconstruction. The bilateral counter movement jump in the black, as well as single leg jump data across the injured and non-injured side. And we can see the progression over time in the velocity that these rehabbing individuals are able to achieve. Remember, again, although this is a downward trend, because we are dealing in the negative, that is representing a faster speed for our injured athletes. As always, of course, this data is both population specific and individual specific. So don't just go purely on the numbers shown here, but this hopefully highlights how tracking this number in your injured athletes can show their progression or perhaps regression over the period of their rehab. Here we can zoom in on an individual example that illustrates this then. Using data from the VALD hub, we can see a pre-injury average around minus 1.0 of this female athlete. That slows down to around minus 0.4, 4 months post-surgery that is, and just a sub-maximal jump at that stage of their rehab, and how this continues to become faster over time as their rehab progresses across 6 months, 9 months, and then a year post-return to sport. So eccentric peak velocity has been one of my exploratory metrics in my counter movement jump analysis system, and perhaps it's one worth exploring in your own setting as well. It's giving us insight into an athlete's willingness or ability to then load through that jump. As always, thank you to VALD for sponsoring this video and all the videos in our athlete testing series, and I'll see you again soon for another Sports Science Insights video.